Welcome to my fourth episode of End of Life Journey with Hospice. It is very important to educate and guide patients and family members to understand the symptoms patients experience due to their illness from early stages of hospice to every change of the cycles and up to imminently dying stage. Most hospice staffs are only focused in providing physical care and sometimes very limited emotional care to patients and family members. Also, most of the time, only limited emotional support is received from the chaplain visiting patient and family. It is very crucial for hospice director of nursing to have the vast experience of nursing practice with in-depth knowledge of diagnosis, illness prognosis, critical thinking in providing knowledge, and the skills required as it would be for in acute in hospital care settings. The director of nursing has to have all these skills and knowledge and know how to educate and guide the RNs, LVNs, and CHAs to provide proper and efficient care to patients, not only physical, but most importantly, the emotional needs. Also, to be able to guide the staff to teach and help the family the skills and procedures to enhance their coping mechanism in providing comfort care, addressing the symptoms of patients with each and every stage of their terminal illness. Most hospice staff are not able to feel comfortable with the patients dying in their home environment due to the lack of their own coping skills and are not able to handle the emotional involvement it requires for them to provide as needed to patients and their family members. Thus, their visits to patients becomes geared only to address the physical and supplies needs for these patients. Furthermore, most hospice director of nursing do not have close contact with their patients and resort to taking care of these patients solely depending on the field RN's comprehensive assessments, which most of the time fall short of the necessary detailed assessment of patients' diagnosis and prognosis of their illness, and the need to foresee patients' complications, symptoms, being able to relay these observations based on critical thinking to the IDG team and be able to direct patients' plan of care to address all these issues. And to be able to provide proper care for these patients. Also, the director of nursing has to be very knowledgeable with the imminently dying stages of patients so that she's able to initiate continuous care as timely as possible to support patients with comfort measures and medications as prescribed and as needed. During these cycles, to be able to explain to family members in details of the patient's each changing symptoms manifested with each changing cycle. For example, change in mental alertness, being aware of their visions, their gradual unresponsiveness, pain assessment and management using nonverbal tools, make the proper assessments with each and every change in the breathing cycles, and to inform Hospice MD for the treatments to be prescribed and provided. Empowering the patient's family members with the necessary knowledge and providing the tools to establish their skills and coping mechanism to provide much needed quality of care and comfort measures to these dying patients in the most fulfilling and successful achievement of the end-of-life healthy closure both for patients and family members, allowing to remove all guilt, feelings, and doubts in their provision of care to their loved ones until their last breath of their lives. With a strong patient advocacy, sound, vast medical areas specialties, and the many years of direct experience working closely with these patients and their families, I feel very privileged to be able to be the ideal director of nursing for these hospice patients, having acquired all the critical knowledge, experiences, understanding skills of all procedures and treatments necessary to be the backbone of all levels of staff, teaching, directing, guiding, and supporting to acknowledge the care needed to be provided to these patients. Also, with direct face-to-face visitations and encounters of myself with these families and patients, I have been able to have all the first-hand reports of patients' visions per their family, witnessing and hearing patients talking about these visions, explaining, educating, and involving family members to be able to keep open communications channels for their loved ones to express these visions and messages healthily as needed, to reassure them that it is okay for them not to fear and that family members feel comforted as well with patients' visions. I would like to share my direct experiences and involvement in taking care of these terminally ill patients, supporting and guiding their family members to achieve the healthy closure for the end of their lives. One of these experiences was a 62 years old lady with diagnosis of metastatic pancreatic cancer, 4th stage. She was a widow living with her son and his family. Patient had been very strong and healthy and was very active, leading as the head of the family until her diagnosis. She was given 1 to 3 months of life expectancy. It was very difficult for the son to accept his mother's diagnosis and prognosis, but the daughter was in complete denial. My focus was mostly to educate and guide the daughter to understand patient's prognosis and her need to end-of-life healthy closure, to also cherish these moments and this time to make it memorable for all of the family. I was able to provide quality of life by treating patient's symptoms of nausea and vomiting. Patient had blessingly no pain. Medications used to boost her appetite, intravenous hydration given as it was needed when she started to decrease her fluid intakes. Patient lived 6 months plus, I would say almost 7 months. Daughter was taking videos of events with mother, taking her out with the wheelchair around their neighborhood, spending quality time with her mother. The patient was able to see the granddaughter's baby shower, the grandson's marriage, and a grandchild's christening within that short months that she had to live. Quality time with daughter involving in patient's visions of father preparing candlelight dinner and seeing long past family friends giving messages about them. The daughter was so astounded with her mother's visions. They were so vivid. She was explaining every detail of her father who had passed long years ago, that he was preparing her a candlelight dinner and waiting for her to join him in the spiritual world. There were many visitations to this patient, and she was very open in disclosing and discussing with her family members, especially her daughter. And the last days when she gradually became unresponsive, the daughter was encouraged to talk to patient and allow her to open up with her visions and messages she might have, to be able to say to her farewell to her mother, that she loved her dearly. It was very difficult for the daughter to do this, but she took every single event that she spent with her mother within those months on videotapes, and she had a whole 6 months of memories, good memories, to build with her mother before she passed away. A second experience I've had is an elderly lady with throat cancer, esophageal cancer. She was end of her 4th stage in our care. She had been very active in social circles, citing poems. She lived with her granddaughter and her husband and 9-month-old baby. The last 3 weeks of her life, the granddaughter was concerned with the patient's confusing remarks. When questioned granddaughter, she stated that patient was sometimes staring at certain directions and in a questioning gaze. When questioned, granddaughter stated that patient was sometimes staring in certain directions, and by questioning to her granddaughter, the patient was saying, "Who is that blonde lady in the white dress sitting at the dinner table with us?" Upon further questioning, the granddaughter acknowledged that her mother had passed away a few years ago. And yes, she was blonde hair. Patient had kept quiet with her granddaughter as she felt withdrawn and unable to express feelings because of her unable to understand and not being able to open up to the patient's visions. It was almost like she was building a wall between herself and her grandmother. During one of my visits, sitting down with the patient and questioning how she was feeling that day, patient was steadily gazing at the edge of a coffee table we were sitting at. And as I asked her what she was gazing at, patient said, "It is so beautiful. A meadow with colorful tulips and children playing all around." I questioned if these children were perhaps angels. Patient looking at me, she nodded and smiled. And when I remarked that they must be very beautiful, patient nodded again and smiled back. I educated her granddaughter to allow her grandmother to express her visions, and that she should ask her if there was any messages from her visions, for her to keep the communication channels open with patient and ultimately make her feel comfortable with them. Patient had a very healthy closure as her end of life cycle towards the end of her life. A third example I'd like to share is a 60 years old male patient with pancreatic 4th stage cancer. Family chose not to tell him because they felt the patient could not handle knowing his imminently dying stage. And he was kept silent about his terminal diagnosis. Patient himself was aware of his dying condition as I visited him, even though we didn't verbalize. But I could see in his eyes, I could see in his remarks as he was talking, but he was never able to communicate effectively with the family members. And the patient died within a month without having a healthy closure to his end-of-life experience. The family could not communicate with him because they found it so difficult to share this important closure with the patient. My fourth experience I'd like to share is an American lady in her early 60s. She had a very late diagnosis of pancreatic duct cancer and a fourth stage with metastases to lungs, liver. Son and daughter were taking care of patient. I educated them with all the symptoms, patient's needs, and coping mechanism to follow taking care of their mother. Siblings initially were competing with each other, and they never got along, apparently, before their mother got sick. And they were trying to compete who was going to take care of the mother better than the other. And were very stressed in doing so. They were taking turns, the daughter at night, the son during the day. After a few sessions of guiding them with the importance of these precious moments for them to work together and give the best comfort for patient, not only physically, also emotionally, to make her end-of-life cycle closure a very healthy one, communicating their love to the mother to ease her anxiety that as brother and sister, not uniting in their care for their mother was increasing anxiety for patient. After several visits and constant education, guidance, and direction of siblings, they became very close to each other so that they were able to provide the best care their mother deserved. Understanding her symptoms and how to provide her with the best loving care, it was a true healthy closure for all involved. As a result, the family urged me to give these much needed teaching sessions to people going through these experiences at their end of life experience with hospice care at home. Another example of these experiences was a very elderly female patient with end-stage Alzheimer's and dementia. Patient had the most natural death, very peaceful, without pain at all, with very supportive family, had a very healthy closure with the family members, without having any continuous care measures to be provided, because she was very comfortable and very peaceful in her last few weeks of her life. Another experience I have is a female patient who had ovarian cancer, metastasized to her liver, lymph nodes. She is another patient that her daughter kept secret of her terminal illness and would not disclose to her dying stages. And the patient, even though she had suspicions that she was dying, she was not able to have any communication with the daughter, and she had no closure to her end of life. And blessingly, she didn't have any pain to suffer, but she never got to express or communicate with any of her daughters as she ended her life. Another experience I have had was an elderly lady with breast cancer with metastases to liver and lymph nodes in her fourth stage. After 1.5 years of chemotherapies, the daughters chose not to inform patient, even though patient was feeling she was dying, and had very high anxiety levels along with pain. She could not sleep for 4 to 5 days and was very lethargic. And as comfort measures were started and as patient became non-responsive, I had to educate the daughters to talk to patient and tell her their feelings and their last messages to the mother before she had the end of life closure. Another experience which I've had was a male, early 60s, diagnosed with prostate cancer with metastases to his backbone, lymph nodes, and lungs. The patient was sent home with 3 weeks to a month life expectancy. Patient came with fentanyl patch already applied, 50 microgram, very lethargic and unable to eat nor drink. He was over-sedated and very hypoxic. Consulting with Hospice MD, we removed the fentanyl patch and provided patient with lesser narcotics to control his pain. And as much as he was tolerating, patient lived 6 months with full family support and only with symptomatic treatment approach, was able to spend quality time with family, and was able to walk his daughter down the aisle for her wedding. In his last month of his care at home, patient started hallucinating and having visions. Again, the family referred to him as being confused and not knowing what he was hallucinating about. The family was educated about the end of life cycle experiences for the patient, and the family was very supportive all the way, understanding patient's condition. Patient had extensive pain management, even though he had very high pain tolerance with SIT level of 4 to 5 over 10. With my direct involvement and guidance to each of the family members were brought closer together. Patient had a very healthy closure with his end of life cycle. As a result, these family members urged me to give these much needed teaching sessions to people going through these experiences with their loved ones' end of life experiences with hospice care at home. Through all of my exposures with these terminally ill patients and their family members, with each and every experience while educating and guiding them with each and every step of the patient's end of life cycle, I was urged by these family members over and over again to present and educate the people with my unique philosophy of the true hospice care for people who needed to be given the knowledge and guidance to help their loved ones to achieve this healthy closure for their end of life cycle. I'm very thankful to God that finally have been given the chance to present this knowledge to people. God bless you all. Thank you for listening. Please stay safe and healthy until we meet again.